A document obtained by CTV News states emergency room waits in Alberta hospitals led to at least 6 deaths and more than 24 delays for patients with serious conditions. Now, the information was gathered by the Alberta Medical Association to understand how the current hospital crunch is affecting Albertans waiting for care. CTV's Nicole Weisberg has the details.
These are just some examples collected to try to get government to share our urgency.
Dr. Paul Parks is referring to this list, collected by the Alberta Medical Association, reported by colleagues, of deaths and near misses in Alberta emergency rooms in recent weeks. The 6 deaths include a woman waiting 8 hours to be seen who was eventually diagnosed with a bowel obstruction. She received emergency surgery, but by that time was septic and ended up dying about 24 hours later. Another, a man who had chest pain for months, went to an urgent care center but left before being seen due to the long wait. He went to his family doctor, was scheduled for a test, but ended up suffering a fatal out-of-hospital cardiac arrest. A third case, almost identical to that of 44-year-old Prashant Srikumar, who died in the Grey Nuns emergency department. It says a middle-aged man had ongoing chest pain, waited 8 hours in the emergency room for a bed, and when he finally got one, suffered cardiac arrest and died.
They're just the tip of the iceberg, and they are just highlighting from my colleagues across the province how severe things are on a daily basis.
The Ministry of Hospitals told CTV News it could not comment on the unverified, anonymized patient information being circulated for privacy and legal reasons, although it takes this information seriously. At a news conference last week, the minister acknowledged the pressure on the healthcare system, driven, he says, by a tough flu season.
There is province-wide coordination. There always has been, there always will be. And I would say that it's the only reason we've gotten through the bulk of respiratory virus season.
He said a pilot project will see a doctor work alongside triage nurses in Alberta's busiest emergency departments. He also said a long-term capital plan is being developed. Nicole Weisberg, CTV News, Edmonton.